So when birthing better started to develop in the early 70s through the mid 80s, and all of the skills really came into focus, how many of us were having home births? Well, back in the 70s in the United States, there were no midwives legally. There were certainly lay midwives. Ina May Gaskin, the end of the 70s, was a very famous one. But there were Vietnam paramedics who came back and helped at births. There were some obstetricians who helped at births, some general practice doctors, labor and delivery nurses. Other people helped at home births, so we had home births. And people birthed alone as well. Many of the families who developed birthing better were highly religious. They were not going to go to the hospital. Others couldn't wait to get there because they had 15, 20 children and they wanted a few days break and somebody to cook for them. So what percent of people had home births compared to hospital births? It was about 50-50. And of the 50% that had home births, how many birthed at home without a care provider? Probably about 20% of those. There was always somebody who was willing to come even though they weren't within the system. You didn't want to transfer to the hospital back then, for sure, because the hospital was not welcoming. But we had always developed skills for all births, and so birthing better families that did transfer to the hospitals, they just continued to use the skills. And if the hospital was rude to them, they shrugged that right off. They didn't really care. They had lots of assessments, monitoring procedures. They'd gone to a hospital for a reason. They accepted those things. They kept using those skills. But we'll talk about that in another lesson. However, I want to talk to you about teamwork. One of the things that families taught me, because the very religious families I worked with, and I'm not religious, and I have no medical training, and I'm not a midwife or a doula or a childbirth educator. That didn't mean that I didn't go to lots and lots and lots of births. I don't have to be anything to be somebody who is at births. I'm just another human being, and I happen to be very skilled. And the families I worked with were very skilled, which meant we were all skilled, which meant we worked together. Working together is called a team, right? So we developed teamwork skills because the teamwork in home births was very, very important. Very important. Our job is to prevent or reduce anything from becoming a problem that I as a birthing woman or I as the baby I carry are put at risk. But it's true of life. You know, we are very blasé about a lot of things about life. We put ourselves in incredible risks all the time without even knowing it. We just pop into a car. It's a high risk. Our diets put us at high risk. Using certain chemicals put us at high risk. We do lots of things that put us at high risk, and we are very blasé about it. When it comes to pregnancy and childbirth, we're not as blasé about it, which is curious when you come to really think about it, because prior to antibiotics and immunizations, regardless of how you feel about those things, 25 to 30% of all of our children globally died before the age of 5 without immunizations. Why were immunizations developed? Because we as a society demanded that, right? So the medical profession just doesn't do things to come around to slice us open. They do things because modern people are demanding that we do things that are risk averse within health. We're not always standing up for the stopping polluting our waters or our soils or our airs or killing the species. We don't stand up for those things. But when it comes to taking a risk at a home birth, those of us who live in modern countries will go to the hospital if we feel that the medical profession is going to save us or our baby. Very few of us having a home birth are willing to die at home or have our baby die at home. So you need to understand that teamwork is very important. We are the primary team with whoever is going to be in the baby's life. Our midwife or doula is not our primary team members. They're our secondary team members. They're not going to be there for the long term. We should teach them the skills that we have learned together. And so in this lesson, you're going to learn the wonderful teamwork skills that we've taken into every birth, but have been particularly useful in home birth because When something looks weird to us who are outside of the birth, we need to know that that woman is not basing her decisions to stay at home on ideology alone. We need to know she's going to take responsibility for the outcome of her decisions. When everything looks good and a woman is sitting there going, we need to listen to her, because just because the midwife or anybody else is saying, oh, everything's looking good, the heartbeat's fine, blah, 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 blah. If the woman is going, you need to listen to her. When she pushes your hand off, she needs to know how to bring your hand back. When she needs to be left alone, you need to know when to leave her alone and when to come back. You need to see and hear and develop that relationship and teamwork, no matter how well you get on the rest of the time, to tell you the truth. The power of birthing better is that we did not make perfect. We perfected our skills, and we used our skills practically.